sit up here? Is that more,
absolutely.
is that more approachable? Is that more relatable? Hey, I'm Dr. Laura Ruof. I like to have fun. I like to sit on counters. Shiver, shiver, shiver. I need to go inside. Let's go.
I'm Dr. Tara, and this is Dental Cribs, where we get to check out the biggest, the baddest, and the best practices around. Today we're in Chicago, freezing our butts off, but we are going to check out this incredible practice.
Hi, I'm Dr. Laura Ruof. Welcome to Dental Cribs. Let's go inside. I am a dentist. I've been practicing for about 15 years. I actually moved from New York City to Chicago to work here with the legend, Dr. Lou Graham. Come on in and I'll show you around. So this is the west side. We're in a historic building called the Windermere in Hyde Park, Chicago, which is a neighborhood that has a ton of history. So we have 3 ops on this side. This is the side that I work on. We have about 6 operatories on the west side as well, where we see patients. We love this building so much that when we needed to expand, we didn't want to move, we wanted to stay here. It's also very close to the University of Chicago, so most of our patients are academics. They're either students or they're professors, and they're the most interesting patients. They're so cool to talk to and see what they're working on. So I will show you around. So these are the 2 ops that I work out of primarily. My one stipulation when starting to work here is I wanted to work on this side because of the windows. It's really nice for patients. They feel like they're in the open air. They're not trapped in here. High ceilings as well. So these are the 2 ops I usually work out of. This is one of my favorite little tools. This is the Gemini laser. I love this for gingivectomies, especially when I'm in the aesthetic zone. It's great just for, if you're taking an iTero scan of a crown and you have a little bit too much tissue, or you want to cauterize the tissue, instead of having to place cord or even use Traxident, you can use this laser. I actually used this the other day. I had an 89-year-old patient. We weren't sure if we were going to be able to do a crown on the tooth. There was very, very little clinical crown, and by using the laser, I was able to expose a little bit more tooth structure so I could have retention for a crown, and we didn't have to do an extraction. So this is our iTero scanner. This makes just everything so simple. We do use it for restorations. This was a patient, crowns on 8 and 9. But we also use it for every new patient gets an iTero scan. And what I love about it is that it allows us to zoom in on things, and we can show patients. It's like a intraoral camera, but 10 times better. So any types of restorations, crowns, onlays, we use it for Invisalign, obviously the initial scans. And then, like I said, every new patient gets them just for records. An office I worked at had a Cerac scanner. Have you ever used that one?
So we have both.
The one that plays the music?
Yes.
I know, I did it one time and I was like, I'm gonna lose my mind, I'm gonna take a PBS impression. This is out of control, this is bonkers. Like, I can't listen to this music. It's like the Phantom of the Opera.
I know, and then when you do it wrong, it like yells at you with bad music. And
Yeah,
you're like,
yeah,
oh,
it plays
sorry.
bad music and you're like, make it stop. This is our Sprint Ray 3D printer. These are the other machines that go with it, the Pro Wash and the Pro Cure. And basically what you do is you take an iTero scan, you can print models in here, you can make a suck down and make a retainer, you can upload it to the Sprint Ray new AI technology that they have where they can design a night guard for a patient. So if a patient comes in and they're in a ton of pain, they need a night guard right away, we take an iTero scan, we load it to the printer, we print a model. The models go in the Pro Wash to get all of the resin off of them. It's a series of alcohol washes, and then it goes into the Pro Cure to cure. You upload it to Sprint Ray. The AI technology designs a night guard for your patient, and then you can print that night guard. So there's different resins. This is dye and model. This is the night guard. There's different materials. This is the flex material. And so then you print a night guard for the patient. The patient can come back that day and get a night guard. So again, it just goes back to that theme of, how can we do the best for our patients? If a patient comes in and they're in pain and I can help to get them out of pain, instead of making them wait 2 weeks for a night guard, they can come back that day and get a night guard. And that's just the best treatment for them. And that's why kind of the philosophies of how we do things at UDP is just, it's really all about the patients and how are we doing the best for them. All right, this is our CBCT machine. We use this for everything. Diagnostically, there's nothing like a CBCT. It's a 3D cone beam scan. Every new patient gets one of these. They get 4 vertical bite wings, and we take a CBCT instead of taking a full mouth series. We're able to see so much more. When patients come in and they're symptomatic, if we take a bite wing and a PA, oftentimes we don't see anything there. And in the past, we would have sent the patient home and said, oh, maybe you need a night guard or something like that. If we take a cone beam scan of the tooth, we can see periapical radiolucencies that don't show up on a 2-dimensional image. I always tell patients, you are 3D, your mouth is 3D, your teeth are 3D. We can take a 2D image, but it's not gonna show us everything. With the cone beam scans, I think a lot of offices might shy away from them because there is a lot more responsibility. If you're taking a 3D cone beam scan, you have to read the whole scan. A patient may be symptomatic on 15, but if you take a whole cone beam scan, a complete scan, you need to look at everything that's in there because you're responsible for reading that entire scan, just like a radiologist. So Velscope, you're supposed to use glasses, but it's a oral cancer detector. So it lights up the tissue. Yeah, it's really cool.
What?
Yeah, so it lights up the tissue. So lesions that you wouldn't be able to see or tissue changes that you wouldn't be able to see, you can see them a lot sooner if you're using Velscope. And you're basically looking through it as you're illuminating the tissue, and you're just able to see any changes. So every single new patient, every hygiene exam, they get a Velscope as well. So this is CariView. It's transillumination. We can see in between the teeth, through the enamel. I can see that you've got composite there. These are awesome for spotting interproximal caries, whether you don't want to take an x-ray on a patient, so we use them on children a lot, or whether you have an x-ray and it's questionable what you're seeing, then you can light up in between the teeth. Yeah, it looks like you have a composite there.
Oh,
I'll take a picture of it.
I'm 4, I do. That is crazy.
It's cool, right?
So is that dark spot in
This here.
That's a cavity?
I think it might be incipient.
That would be amazing to have in my practice. It's my favorite. I have one of these. Actually, I think I have the older model. No, I have this one too. It's very nice.
All right, guys, you gotta go. I have work to do. Thanks for coming.